Well, thank you guys for being here. Everybody knows me. I'm Dr. Adamo. It's a pleasure to have each and every one of you guys here. Okay. What we're going to do is we're going to go over some stretching techniques today. Okay. So you want to learn how to stretch. You guys want to learn how to keep yourself healthy at home. Because remember, you're only here for a certain period of time, right? Then you're going to go to wellness. When you're on wellness care, you're going to be here even less. So the more you're at home, you want to know what to do at home, right? So you guys want to know exactly what you need to be doing every day at home. So this is what this is going to teach you today. We're going to do some basic stretching. If there's any questions, at the end, please, okay? So let's go over, okay? We're going to go over some good information first about your spine, about the nerve system, about the muscles, so you get a little educated about the body, and then we're going to go into stretching, okay? So the purpose of this workshop is to show you how to prevent musculoskeletal disorders, okay? So musculoskeletal disorders, what are they? They can affect the muscles, the nerves, the tendons, the ligaments, your joints, cartilage, your blood vessels, and your spinal disc. So all these muscle disorders can affect all these different things, okay? So musculoskeletal disorders cost this nation $50 billion a year. So many people have all these disorders and are sick, and it's cost them $50 billion a year to get themselves well and get themselves healthy again, okay? And what are the most common ones? Neck, shoulder, low back pain, carpal tunnel syndrome, restricted movement, joint problems, damaged nerves causing numbness and tingling. And I know half the people who are in this room have at least one of those here, right? So a lot of you guys are here because of this stuff, right? So we want to get that better. There are many different causes of musculoskeletal disorders. They can occur as a result of what? Activities at home, at work, or what? Or any type of leisure thing. Things that you like doing on the weekends, playing sports, young kids, doing dance. So all these different disorders can happen just from doing things that you love to do. Or even going to work. That's how you develop them. So let's go over a couple of different things. They also can occur as a result of what? A lack of exercise and a failure to properly stretch before exercise. So most people go to the gym here, and they don't stretch before they go to the gym, right? And then what happens? You come home from the gym, and you don't even stretch after the gym. So you're doing all this exercise, and you're stretching your muscles, and you're working out your muscles, but you're forgetting to stretch, which is the most important part, to keep yourself from getting tight, keep yourself from your muscles actually breaking down. Does that make sense so far? Mm-hmm. So that's why we're going to teach you to do this, so you can do this before your workouts, okay? Athletes stretch before beginning their competition to prevent injury and improve performance. So at dance, you stretch? Mm-hmm. Exactly. So when the girls are dancing a lot, or you're playing on a professional sports team, or even intramurals, what do? Everybody stretches before you get out on the field. So I played soccer for years. What we did, we stretched before we got out there to prevent injuries. Right? So it's very good to prevent injuries, right? We don't want to get hurt. So let's go over a couple of Stretching, what it does, it loosens tight muscles and the ligaments. So the purpose of stretching is to do what? Loosen yourself up. Okay? So ligaments are those tissues which connect one bone to another, and they involve in the joints and involved in all the joints in your body. So you have muscles and ligaments everywhere, right? So if you took all the muscles and ligaments out of the body, you basically fall to the ground. Okay, your bones are held together from your muscles and ligaments. So you want to make sure those are all loose. Okay? Tight ligaments and muscles are more easily torn or injured. So what happens? You don't stretch before a soccer game, and you go out and you run, and your muscles are tight. Why do you think so many people get injured? Why do you think these basketball players, they don't stretch before they're playing basketball, and they tear their ACL? Right? So you want to make sure you're stretching before you go out and do any types of exercise or any type of physical activity. Okay? When a joint is injured, especially in the spine, it can cause damage to the nerves that are in that area. So everybody knows here, you're all here to work on your spine and nerve system, right? That's the most important system in your body is your brain and your nerve systems. So the nerves control everything, and you want to make sure that nerves are functioning at 100%. So what? The muscles and ligaments can function at 100%. Make sense so far? Okay? Since the most musculoskeletal conditions can be prevented with daily stretches and exercises, we're going to teach you a program that can easily do at work or at home. So we're going to go over some things right now, okay? It says, however, exercise and stretching can further aggravate or already damage a joint, torn muscle, or spinal misalignment if not carefully supervised. So some of these things that you're doing at home, some of you guys come in here and say, well, Doc, I did this stretch, and now my back is killing me, right? Because you're not properly doing the stretching or exercising. That's what this slide's showing. So we want to teach you the proper way to stretch your body. That's why everybody's here. Okay? Let's keep going over this. So this examination will show you areas that should be a concern to you. So we're going to do a couple different tests. Okay? So everybody's basically, we're going to follow everything in this slide. So when we're going to basically mirror image what the slide shows. So we're going to do a test right now with specific exercises to see how well you guys are doing. Okay? The first one is seeing if you have trigger points or spasm in irritated muscles. So we don't have to touch each other, number one. But number two is if anybody's feeling stress or tension, that usually means there's a trigger point or a muscle spasm in an area. So Tony just came in now and said, hey, my neck's killing me. I touched her spine and she felt it right away. Trigger point, right? Stress in a muscle. Same thing when I work on all you guys during the week. Her arm was hurting the other day. I touched the spot, boom, trigger point, right? A trigger point is what? It's a knot in the muscle. It's the muscle locking up on you, okay? So when that muscle locks up on you, what happens? It tightens up, and what happens? It causes pain. It causes irritation. Make sense? Okay? So, come on, everybody stand up, okay? We're going to do a neurological stress test. Okay? All right? So what you want to do is go like this, okay, for 10 seconds. You want to make sure you feel no numbness, no pain, no tingling, all right?
We feel all that.
I'm good now.
Okay, good. Okay. Next one is do what? Touch your toes. All right, so try to touch your toes. Stretch your leg. Don't bend your knees. Okay? Don't bend your knees and breathe. Now, when you're stretching, you want to do what? You want to breathe, right, guys? Breathing is key. Good.
I'm the only one who can do it.
You can't do it?
No bending the knees. Knees straight, legs
Knees are straight.
You know what you do? Bend down and just hold your hands together. Yeah.
Yeah, I do it. I can't go
No, you can't go far. Okay.
I can't before. Okay?
Not yet? Soon.
That's not that bad, though. I mean, you're almost there.
Okay, come back up. We're going to go through some
More
more. Hold on, let me get
adjustments?
through it again.
Better off. You gotta start. You gotta keep stretching at home, and you'll be able to.
Okay, hold on, we're almost there. Okay, bending down, all right? So this one now is the pelvic, so we want to check your pelvis. So now it's front up. Keep your body up
Anyone?
and bring your knee up. Yep, any leg. Okay, hold your balance and breathe. Be careful,
At all.
right? So some of you guys are sitting here, you're swaying. What does that show you? Your neurology's off, number one, right? So be careful. That's why we're working on your nerves, right? To get your neurology back. Now stop and do the other leg. Coming up. Bring it up.
That one.
Good. Okay? Now this is a simple one. Everybody relax. A simple one is what? Do you get pain when you turn your neck? So keep your head. No, you want to keep your shoulders straight, not turn your body. You just want to turn your neck side to side, slowly. And do you get pain?
A little bit.
Well, that shows that you have muscle tightness. Okay? So if you're getting pain or discomfort, we check. That's why we check you for subluxation. Right? You hear a little music? Turn your neck and hear some music? Okay?
Yeah, a little pain.
Okay, now this one's pretty hard, okay? It's getting your hands like this. Okay? How much can you touch your shoulder blade and get your other hand up to your shoulder blade? So that's a really good stretch for your shoulder blade. Yeah, very good. Yeah,
Yeah, Chris.
Like that?
very good. Good,
I
Barbara.
have to see
So
it.
if you feel like, if you can't get your hands pretty close, that what? You already have restricted motion with your shoulders. So some people can who what? They have rotator cuff injuries. Some people have other injuries in their arms, and they can't move their arms. So this is a great thing to do to stretch your arms. A lot of people that play baseball, tennis,
There was one.
right? You play tennis, great way to stretch your arms. You feel it too, right?
Yeah, I'm feeling it.
Good. Okay, we already did the roots test.
Sometimes it's
Okay, so everybody have a seat. Sit back down. Thank you. for participating. And we're going to go, don't worry, we're going to go more.
She goes, I feel this.
Yeah, so sometimes, like he said, Arlie's saying he does better with one side than the other.
That's
Right?
normally.
So also, you're thinking, some of us are righties and some of us are lefties. Some of us just use our right hand all the time and some of us never use the left hand. So you want to make sure everything's balanced. You don't just want to stretch one leg, you want to stretch both.
Right.
Make sense? Okay, so if you failed any of these tests, it indicates that you have a physical problem. A lot of you are sitting here or in my office because you know that you have some problems, and we're here helping you get well, right? We're here making sure that you're subluxation free, that you have no nerve pressure, and that what? You restore normal health, right? Everybody remembers that the body heals from where? Inside, right? It has nothing to do with a pill or a potion or a lotion. The body heals from inside. So we want to make sure each and everybody is expressing that health, is expressing that life. Make sense? Okay? So a physical problem responds best to a physical solution. So a lot of you guys came, right? So a lot of you guys came here and said, you know, I have this neck pain and I take aspirin, but my neck pain doesn't go away. Does it make sense? Why? Because you have a physical problem like nerve pressure or a musculoskeletal problem, but you're taking a chemical for it. So you can never get rid of a physical problem completely with taking a chemical. That's why drugs don't work. Because a lot of doctors, what they do is they just give you the chemical, but you don't have a chemical problem in your body. You have a physical problem. So you have to literally fix a physical problem with physical. That's why we work on you with our hands. We work on you with some of the machinery here because we're physically working on your physical problem. We're not just telling you to take drugs, right? And that's why a lot of you guys see that you take the drugs and none of the pain goes away anyway. Some of you have taken heavy painkillers and still the pain doesn't go away, right? So you got to distinguish that. You want to understand that if you had a chemical problem, a drug would help that. But most people don't have chemical problems. They have physical problems. So the more physical problems you have, the less a drug's going to work. Does that make sense to everybody?
Yes.
So when you take drugs, you're taking them for no reason. Now, what do drugs have? What do each one have? Side effect, reactions, right? So you take a drug for your neck pain, what does it do? It causes liver damage, right? You take aspirin for a headache, and it causes ulcers, or it causes the lining of your stomach to bleed, right? So you want to make sure, God bless, you want to make sure that you guys understand that drugs are only for an emergency, okay? They're not something that you want to take long term. If you're sick, first of all, we don't want anybody taking drugs, okay? Number one, we do not believe in taking medication in this office, okay? It is used only for an emergency. If you're sick and you, God forbid that you need it, it's a temporary thing, and then what? You come off of it. That's not what they do in this country. In this country, people stay on it for how long?
Years
For years and years. Most likely forever. Forever.
Why?
Why? Because they never got to the cause of the problem. Right?
Money.
And it makes money. But the thing is that you got to realize you need to get to the cause of the problem. Not just mask the symptom, right? We're not trying to just mask your symptom, make believe it's not there, okay? We want to address it so it what? We get to the cause and it goes away and it never comes back. We're working on you here. We're working on, every one of you guys are getting worked on for the cause. We're not just trying to rub you down and make you feel good. A lot of you wouldn't come in next week because you felt better already. But we're continuing to work on you even when you feel good because we're correcting the cause of the problem. Does that make sense? Okay? So, solution to physical problems can be correcting your spinal misalignments, reducing your muscle spasms, repairing torn or damaged muscles and ligaments, and a routine, gentle stretching. Okay? The following stretches can be done at home or at work. They're best done first thing in the morning and the breaks throughout the day. Stop if you feel pain when we do them again. So we're going to do different ones now. Okay? So remember, it's always the best to stretch when? Right when you get up. Because whatever, you're laying down for 8-9 hours. Some of you lay down for 4 or 5. Some people sleep longer than others. But the thing is that what? You get stiff when you're sleeping, right? So the best way to stretch is right when you get up in the morning. And I tell a lot of people do that. Especially you guys have that low back pain. What I tell you to do, stretch your legs before you get out of bed. Before you go to bed, right? How about during the day? If you're sitting working all day long on a computer, on a chair all day long, get up for a minute or two. Stretch your legs. Stretch throughout the day. This is what it's telling you. Stretch throughout the day to do what? Keep yourself loose. Everybody's got to remember, motion is life. The more motion you have, the more life you're going to have. the more, you see the people walking around, they're walking around very slow. How much life do they really have? So the slower you are, the more your body's going downhill. That's why I teach you guys to stay loose, because the more motion you have, the more life you have. Does that make sense? Okay? So, everybody stand up. Let's go. First one is do what? We're going to reach all the way up. We're going to stretch it all the way up.
On the toes?
Yeah, no, you can keep your flat feet all the way up as much as you can. Count to 10. Right? So you're getting a good stretch all the way up. So what are you doing? You're stretching your whole torso up. Right? So you're getting a good stretch. You'll probably feel it underneath your shoulder blades. Okay? And relax. Okay? The next one is a wrist exercise. For some of you guys that come in with wrist problems, what you want to do is you want to make like a circle. So you're circling up and then you're circling down. So you can feel your wrists move around. Okay? So some of you are saying hi, right?
Yeah,
Hi.
no, I'm saying wash on, wash off.
Yeah, so a lot of times some of you guys coming in with the carpal tunnel. Now it's not moving your whole arm, it's just your wrist.
No, it's the wrist.
Just try to move your wrist.
Isolations.
Yeah, you're doing good. So you want to make sure that what you're doing is what? You're keeping your arm stable and you're just moving your wrist. So a lot of you guys are on the computer, what are you doing? You're keeping your wrist in a set position, and then you're wondering why your wrists hurt, your muscles and your arms are getting tight all the time. So it's very good when you're at a computer to what? Relax a second and move your wrist around. Make sense? Or what? If you're cutting hair, you're over people cutting hair all day long, your arms and wrists get tight. Yeah. Okay, so this one's just another neck exercise. So what? Just think, ear to shoulder. Now don't move your shoulder up, but just move your ear all the way to your shoulder. Good. Now you should be able to feel that. Okay, a lot of you are going, oh yeah. Okay, ear to shoulder. This is a very good exercise for your neck. Now the other side, ear to shoulder. Very good exercise for your neck. Okay? And as you're here, I'll teach you deeper and deeper stretches. I mean, each one of you have different things you're coming in with, and some of you I show how to pull your head down, and you stretch different muscles. Okay? So that's a great thing to do in the morning. You get up, what do? You stretch all the way up, you touch your toes, you go ear to shoulder, you're at work on a computer, you're doing your wrist exercises. Make sense, guys? Okay? Okay, this one is shrugging your shoulders. So you want to shrug your shoulders up. Okay? A lot of times I tell people shrug their shoulders up and try to make like a circular motion. So you're stretching them out. You feel you're stretching your chest and your back. Okay? Now, how easy are these to remember? They're pretty easy, right? It's not like rocket science, right? So they're not so bad. So some of you can say, oh, I don't remember them. I don't want to hear that this week. Okay? They're pretty easy to remember. Okay? Yeah, and you don't have to just go back. Like Tony said, you could go forward too. Okay? Yeah, you'll hear it. You'll hear it. It's okay. That's the leg that's moving around. Okay? Now this one, be careful because you're going to stretch your quad. So you're all sitting by a chair. Hold on to your chair, and you're going to pull your leg back. So you're going to stretch your quadriceps. Now some of you with knee pain go very slow and very easy. Okay? Slow and easy. So what you do, you hold on to your chair for your balance, you grab your leg, and you pull it back to where your thigh is straight to the floor. Okay? And some of you will feel it if you have knee pain. Okay? Okay? Does you feel it stretch? Yeah, you feel it stretch? Be careful. If you're cramping, what does it usually mean? You're not drinking enough water. Okay? Hydration is very key, guys. Now let's go with the other leg. Easy. Okay, other leg. Slow and easy. Watch your balance. Keep your eyes open. Next thing, what? Don't forget to breathe. Deep breath. Yes, now. Beautiful. And let it down. And you'll feel it. Wow. It was loosening my leg up, right? So when was the last time a lot of you guys did that one? Yeah, exactly. Right? Now next one, you're sitting in your chair. Okay? So the next one, I'm going to do it on a table like this, but you're sitting in your chair, you're keeping your feet out, right? And you put your arms all the way up. Yeah. And you're breathing at the same time. Breathe. This is actually a good ab exercise because you're tucking down your abs. Some of you point your toe towards your nose, and you'll feel it more on your calves and your legs. And breathe. Beautiful.
Use your head and on the back of the
Beautiful.
chair.
Yes. Beautiful. You can do that for your neck. Yes. So far, so good? Okay. Now you stand up. And this one, you're literally going to turn your chair around, and you're going to lean over. So you're going to keep your feet straight. So first you see this is she's bent a little bit, and then the next one is the harder. So you're going to go first. You're going to bend a little bit, like you're going to bend, and then you're going to keep your feet completely straight, where you're bending like this over your chair, and you should feel it all in your legs, the back of your legs, yeah, and your shoulders. So far, so good.
Your shoulders should have pain. I don't know
No
what
pain, no pain. None of this stuff should cause pain. It should cause like that stretching feeling.
It's hurting my shoulder. My legs are
Back of
fine.
the legs on your back, yes.
My legs are fine. It's hurting.
So some of you with low back pain, great stretch to do every day. Right? And breathe. Come on. Breathe. And relax. Come on up. Okay? Now next one's you're in your chair and you're kind of like putting your head in your crotch, okay? So you're stretching all the way down. Yeah, exactly. Yeah, this is one like if, the plane's going down. It never does. Yes. So you should feel that in your back too. So, but you bend your head and neck down because you'll feel it in the back of your neck. This one's actually really good.
This one's a roller coaster.
Okay, and breathe. Good, and go easy. Don't overdo it. A stretch is supposed to make you feel good, not hurt you. Okay?
Feet together.
You can do feet together. Yeah.
Shoulder width apart or something.
Whatever's best for you. You can tweak your stretches. Believe me. Okay? So you could twist a little bit differently. You know, some of you know that you tight around here. You're tight on this muscle. Move it around, guys. Motion is life. Okay, and relax. Okay? Same thing. Now you're in your chair, and what are you doing? You're picking your leg up, and you're pulling it to your chest. Good. So you're pulling it all the way to your chest, and you should feel that stretch. Feel it? And breathe. Beautiful. Yeah, this one's pretty good for people. Now do the other leg. It's all right. Good. You're trying to pull it to, yeah, this one's tough, especially if you have the knee problem. So you're pulling it to your chest as easy as you can. You're trying to keep your heel toward, same thing, towards your hamstring. So you're pulling it all the way back. You see how she has her heel almost back towards her hamstring? Good. And relax. Okay? So it says some authorities say that 90% of all North Americans will experience a back problem sometime in their life. So preventing it is the solution, right? So we want to prevent back problems. 90% of people walking outside are going to have a back problem. And what you're doing is not only taking care of it, but you're preventing it from ever happening again. Okay? If you fail 2 or more of the earlier tests and you also have symptoms on a regular basis, you're at a high risk for having more serious problems or injury. The solution is to correct the physical cause of their musculoskeletal disorder as soon as you can. So everybody knows you're here. Why? Everybody's here because they had an issue. Okay? But the thing is that we're working on it to what? Get you well. Does that make sense? Mm-hmm. Is there any questions so far?
Yes. Can you give us a printout of the exercise?
I
As picture, so this way we can
if
follow.
you give me, Christina, I gotta get pictures of them.
That would be the great.
Yes. If you give me till Tuesday, and I'll have Christina print you out a bunch of these stretches so you guys have them at home and you can follow them at home as well. Does that make sense? Any other questions? Any other questions?
Yes, you mentioned stretching first thing in the morning. Is that in bed or when you get falling out the bed?
I like to be honest with you, like for yourself, I like you to be in your bed. Excuse me, hold on one second. We got a great question here. He's saying, do I stretch in my bed when I get in the morning when I wake up, or I stretch outside my bed? The best way to stretch, especially your legs, is in your bed. You lay on your bed and you pull your leg up, okay? Now we have the TheraBands here so you can pull your leg back, okay? Number 2, you can put a towel and pull your leg back. So you want to stretch your legs, especially all you people with low back pain or cramping in your legs, okay? You got to stretch. The next thing you do after you stretch both legs, then you come out and you do your stretching up. You go down, do your neck side to side, right? If you're at work, the wrist stretches are really good for work when you're at work. So if you want to do like just a quick routine, what? In your bed, stretch your legs. Then you get out of bed, you stretch all the way up. You come all the way down, touch your toes. You You do your neck, stretch your neck, back and forth. Move on with your day.
Now,
Keep going.
Sound great then.
the stretch that the doctor did earlier, I laid on my back and he had me twisting.
Yes.
Yeah.
So he
Now,
was.
Do we duplicate that? What we do here, do we duplicate that at home?
There's certain things each one of you we're gonna go separately because each one of you have different problems, and I'm going slower with each person depending on how long you've been here, how many adjustments you had. So yes, we will be teaching you stretches for you to do at home. So if Dr. Bruce was showing you how to stretch like your TFL, which was he was stretching you.
Yeah.
So yeah, that's something that I would want you to do, but not yet. Like
Not
until
yet.
you get comfortable
Okay.
with him doing it and say, "Oh, that feels good."
Yeah.
That's when I'll start having you do it at home.
Okay.
Okay, so a lot of you guys, when you have questions, even when we're both working on you and you have questions, always ask, guys. Don't hesitate to ask us questions.
Okay.
Don't hesitate to tell us, "Hey, that hurt," or "Hey, that felt great. Can you do more?" Right? So don't ever hesitate, okay, guys? So you want to, the best thing is always to be open and honest with us the same way we are with you guys. Okay? Barbara, you had a question?
Yes, no, it's not a question. I just want to say observation. If you have pets, the first thing you'll notice that the dog does in the morning is stretch. All animals, the cat, when they wake up, that's the first thing all animals
So
do.
you're saying
My
that...
fish doesn't.
My fish
Your fish probably blows a bubble.
So you're saying, guys, that our pets are smarter than we are.
Yeah, basically.
Exactly. Guys, so we're basically at the end of the workshop. I'd like to thank each and every one of you guys for being here. This workshop's not
Pay us,
one-on-ones.
Vinny.
I'm sorry? I can't hear you.
Go over the first two trees.
Have some water.
Okay, so the first two, Pat, was straight up, all the way up. Keep your heads up.
Gotta do it.
Okay, so yeah, stand up. Go
Stand
ahead.
up. Participate.
Teresa, go ahead, stand up. All the way up. Okay.
While we work.
Then you're going to go down and touch your toes. Good. As easy as you can. Easy as you can. Good.
Alright.
Very good.
Okay,
He's been
okay.
stretching. I mean, you've been yelling at him to stretch a lot. He's been doing good. Okay. Another one was good for your hands for circulation. You keep your hands up because what you're doing is you're getting your nerves working properly, and you're doing like this to make sure you don't get numbness and tingling in your fingers. So it's another good stretch too. Okay, especially for your hands. You're an artist.
Yeah.
Okay. Guys, like I said, I thank each and every one of you guys for being here. We appreciate you guys' patience. Everybody remember, it's always good and helpful to tell your friends and tell the others about our office. We're trying to keep your friends and your family healthy as well, not just yourself. Next week, I want everybody to know, Thursday next week, Patient Appreciation Day. It's a great day to bring friends and family in. They get everything for free on that day. Exam, x-rays. We'll be having refreshments. Barbara will have your hummus here this time. Okay? So, on Thursday next week, it's a free day for you to bring in friends and family. I appreciate your time. Thank you so much. Enjoy your weekend. Enjoy your weekend.